Hello, everyone, and welcome to the Recruitment Tips and Tools presentation. This presentation is brought to you by the Clinical and Translational Science Collaborative. This presentation will provide a broad introduction on recruitment and retention. Topics of discussion will include the roles of a participant recruitment specialist, the overall importance of recruitment, an overview of what a recruitment plan is, provide helpful tips to consider for recruitment, and provide you with some useful recruitment tools. What is a participant recruitment specialist, or PRS for short? They are a designated point person at university hospitals, Cleveland Clinic, and Metro Health to provide recruitment services. Some of the services they provide to study teams and principal investigators are recruitment consultations, help with developing recruitment plans, connecting study teams with an institutional point person, provide suggestions for diversity in recruitment and recruitment plans, and provide additional tips and tools to help with recruitment. It is always beneficial to consult with the PRS as early as possible to help guide you through developing your recruitment process. They can provide additional insights into what recruitment methods can be best for your study. As a PRS, the goal is to help study teams achieve their recruitment goals and make the study successful. According to clinicaltrials.gov, the number of clinical research studies increases every year, thus makes recruitment increasingly more important. So why is recruitment important? Each year, $1.2 billion is spent annually on only patient recruitment efforts and delays. 1 out of 5 clinical trials terminates early due to poor enrollment. 11% of clinical trials fail to enroll a single subject. 9 out of 10 clinical trials double their original timeline to meet study enrollment goals. And delays in study startup can result in lost revenue of as much as $8 million per day for drug developing companies. Most importantly, it is stated that approximately 80% of studies fail to meet enrollment timelines. Studies may fail to reach their enrollment timelines for reasons such as poor consenting, strict inclusion criteria, intensive study design, etc. Recruitment is a large integral part of research. Without recruitment and enrollment of study participants, there can't be a research study. To help your study reach its enrollment goals, it is important to develop a recruitment plan. A recruitment plan is the overall roadmap for study recruitment. It is written by the PI and the study team and is ideally developed during the grant protocol writing process to help decrease the chances of having to change your recruitment methods after the protocol has received IRB approval. If you are writing a grant for an NIH study, a recruitment plan is required for grant submission. It helps study teams determine what methods are best for recruitment and provides an outline and timeline for the recruitment process. Something to consider when developing and designing your recruitment plan is who your study population is going to be. Why is a recruitment plan important? It is important because it is an initial written document or outline that identifies the study population and provides how to best engage that population to attain full study enrollment within the time allotted for recruitment. What are some things to include in a recruitment plan? Engagement of patient advocacy groups, how to identify and screen study participants, multiple different recruitment strategies, retention and adherence strategies, and engagement of the surrounding communities. There are some key factors to consider when you are developing a recruitment plan. Aim for a design with low participant burden. For example, if you are conducting a study that does surveys and blood draws, consider using an online survey that can be done from home or incorporating blood draw labs that are out in the community closer to the participant's residence. Set reasonable timelines for recruitment. Setting unrealistic goals can make the pressure of recruitment more difficult. Use different recruitment mediums. For example, you may need to utilize flyers, attend community events, promote studies on social media, and meet people in the clinic, all of which are different mediums, but could set a study up for successful recruitment. Provide multiple locations where the study can be conducted, such as satellite offices. Connect with the community and community advocates. Take the guesswork out of what some participant barriers may be. Consider administering community surveys to gauge the interest and research of the community. Figure out what is best for the community and identify the reasons they would participate in research. Then assess how to accommodate those barriers. For example, where participants need transportation, consider providing Lyft or Uber for transportation, and other factors such as childcare, compensation, etc. Consider using various communication methods. We will discuss some of these methods later in the presentation. Now that we have established what a recruitment plan is, let's briefly discuss what makes recruitment successful. The number one element that makes recruitment the most successful is trust. Trust is built on consistent actions over time, and those actions should be continuously used. It also helps create a positive environment for everyone, both study staff and study participants. When you have a team of compliant staff and study participants, it helps produce better, more consistent data for studies. Better data always equals a more effective treatment for all. We just established that trust is the foundation for recruitment. What are some ways that trust can be established within a community? First, identify the perception the community has of the Institute. Many communities will relate the trust that they have regarding research to the trust that they have in the institution. If they've had a bad previous experience, they may be more hesitant to participate in research. Create a personal connection and build relationships. Consider partnering with local organizations and attend events such as food drives, block parties, and community talks. And consider any outside factors that may help with enrollment and retention, such as childcare, transportation, and compensation. Always be sure to be open, maintain communication, and show appreciation. Provide a survey and gather feedback. Let the community have a voice. Once you've established trust within the community, it is important to build that trust with the individual members of that community. Some ways to build trust are: be prompt, reply back to messages within 24 hours. Be transparent, always allow an individual to ask questions at any point throughout the study process. Communicate clearly. Ensure the participant understands all aspects of the study. The more a participant understands about the study, the more comfortable they will feel. The importance of diversity within research has become increasingly more important. Therefore, it is paramount to genuinely gain the trust of diverse communities. Some ways to connect with other diverse communities include being aware and addressing the past mistakes that have happened within clinical research. Acknowledge that situations such as misuse of Henrietta Lacks and the dishonesty of the Tuskegee experiment exist, but provide assurance and examples of improvements that have been made within research to protect participants of diverse populations, such as new FDA regulations, institutional review boards, data safety monitoring boards, and most recently, the NIH mandating the inclusion of women and diverse populations in research grants. Stress the importance of diversity in clinical research. Without diversity in research, advancements in healthcare cannot be accurately made. Health conditions affect all people differently, and it is important to know how to appropriately treat all people. And encourage the importance of change. It only takes one person to start making a change. Let others know and be proud of the successes that are made throughout the process. Now that we have discussed tips to make recruitment successful, let's talk about some helpful recruitment tools. Over the years, there have been many recruitment tools that have been developed. However, many of the traditional recruitment methods are still very useful, such as in-person recruitment. Some types of in-person recruitment include referrals, such as a physician or staff member in the same practice as the PI recommending a patient to the study, or a physician or staff member in another specialty referring a patient to the PI or the study staff. Consider screening physician clinic schedules in advance. Reach out to the physicians, inform them about the study, and meet with patients before or after their appointment. This encourages study staff to build a more personal connection with physicians and with potential participants. Also, talk with fellow coordinators or research assistants. No one knows the importance of recruitment like research staff. Connecting and collaborating with other groups provides an open environment to share ideas, patient interests, etc. When connecting with someone in person, there are some tips to consider. Be open, friendly, and approachable. Engage in conversation. Ask them about their day or how they are doing. You never want to make them seem like they will be just a number. Assess body language and acknowledge the obvious. If someone is wearing a sports shirt, strike up a conversation with them about that team. Communication is a key tool for recruitment. There are many different ways to communicate with participants, such as phone calls, email, mail, print materials, brochures, and community events. It is important to meet people where they are. For example, phone calls and mail may be better for senior demographic or those who have difficulty with technology. However, some participants may respond better to email since most email addresses stay the same while phone numbers may change. There are many digital recruitment tools that have progressively developed within healthcare. Some common digital recruitment tools include medical record queries. These can be used for screening department or clinic schedules and using tools such as Slicer Dicer, a feature of Epic, or Trinetics to gather a list of patients that meet a study's recruitment criteria. ClinicalTrials.gov, a public database platform that provides a summary of clinical trials that are being conducted worldwide. Research Match. This is a program used to connect people that are interested in participating in research studies with research of different institutions. And digital promotional materials such as electronic flyers. Since the beginning of the COVID-19 pandemic, the need for digital recruitment tools has significantly increased. Currently in 2022, the trend for research study design is a hybrid model. Approximately 1,300 studies are to be initiated in the hybrid capacity. This is a 28% increase from 2021 and a 93% rise from 2020. It is more important than ever to consider incorporating digital recruitment into your recruitment plan. Considering the increase of importance, we will discuss some of the more recent trends for digital recruitment. First is e-consent. This can be done through platforms such as RedCap, DocuSign, and Epic. Virtual study visits. As mentioned, many studies are adhering to a hybrid model. So things such as phone call visits or Zoom or video conferencing are great ways to make recruitment easier. Text messaging is a great and easy way to connect with participants. Services such as Twilio and MyCap can make that possible. Additional digital recruitment tools are posting on an institutional study search tool. This is a way staff, physicians, and patients can see what studies are available at the institution. Department research web pages. These are housed on the institution's webpage. It provides a brief study overview and staff contact information. Social media such as Facebook, Instagram, Twitter, and LinkedIn. You can gain help in developing these posts by contacting your institutional marketing point person or consulting with an outside service such as /clinical or high enroll. Social media is a perfect example of meeting people where they are. Many professionals may prefer LinkedIn, while a younger demographic may prefer Instagram. Google search engine marketing. When searching on Google, it can generate your study when the study condition is being searched. A paid advertisement can almost guarantee visibility and pushes it to the top of the search results, while unpaid requires additional searches for visibility. And QR codes. These can be promoted on flyers and print material. It is another method of drawing a person's attention to your website. Before recruiting any participants for a study, all recruitment materials and tools must be approved by your IRB. Keep in mind that some tools mentioned may not be allowed per your institution, so it's important to follow the guidelines of your institution. As a reminder, get approval for any and all recruitment tools at the start of the study. Even if they aren't used initially, you can use them at any point throughout the recruitment process. While recruitment is critical to a study, research retention is equally as important. How one is treated during a research study can impact their overall view of research. The best way to retain study participants and ensure a positive outlook about research is to show appreciation. This can be done through newsletters, final results of a study, recruitment and study updates for those studies that are not yet complete, greeting cards, study compensation, etc. It is also very important to be transparent with research participants. Some participants will consider withdrawing from studies because they are not adequately informed about the study process. Be open and communicative throughout the entire process to prevent any fears or doubts. To close out this presentation on recruitment tips and tools, here are a few of the key takeaways. If available, consult a PRS. They can help guide recruitment efforts. Have a well thought out written recruitment plan. Understand your study population. Determine which recruitment tools are the most impactful for your study. And build trust with your community and study population. Thank you for listening in on this session. We hope we have provided you some useful tips and tools to help make your study's recruitment successful.